3, 2, 1.
Coming live from Watsonville, California at the Ben Silva household, but next to the chimney right by the fireplace, it's the B&E podcast.
Hey. Alright, we do that every time now.
Oh no, please don't. That sounds terrible. Alright,
How you doing?
I'm doing pretty good. How about you, Ben?
We have a special guest today. This is a new Mike. His name is Mike.
His name's Michael, but he goes by Mike.
That's so funny.
Yeah.
His name is Mike. Okay?
Yeah, I totally understand.
I'm just kidding.
It's really funny, yeah.
Yeah, it's really funny. Alright, Eddie, how you doing? How you doing today?
I'm doing pretty good.
Doing good?
Yeah, I just had some stuff I had to take care of before this, but now I get to have a conversation with Ben and...
This is brought to you by Red Bull, by the way. One Red Bull a day keeps the doctor away. Just kidding, they're not paying me for shit.
Yeah.
Cool, man. Well, this is the second time we've met so far.
Yeah.
Doing this thing. This thing that it's still a pilot type of...
Yeah, we're still figuring out the kinks on this puppy, so...
We can still introduce ourselves. I'm Ben Silva from Santa Cruz. This is Eddie Holzman.
I'm Eddie Holzman. Nice to meet you.
Yeah. I'm not gonna lie to you. I think the last podcast I was kind of hungover. I'm not gonna lie about it.
What'd you do the night before?
I don't remember.
You don't remember?
No, what did I do? No, not like that. Not like, I don't remember, but I just can't think of what it was. Oh, you know what? I think I hung out with Joel and David Salinas.
Do you remember what you guys did?
Yeah, we didn't really do much, honestly. We just walked around downtown and went to go eat at Betty's. And then went to like the boardwalk. And just walked around there and then pretty much called it. Because, yeah, I mean, we're all grown up. We're all old people now, so, you know.
Yeah, that's the same. Today's the oldest you've been and the youngest you'll ever be, so the era of time only moves forward.
Yeah, so, that really is.
I love those like really stupid corny sayings, believe me. I can give you them all day
They sound so deep, but they're so, like, at the end of the day, you're just reciting the truth.
Uh-huh.
Today is a day.
Yeah.
Yeah, man, let's talk about something, dude. Let's
Okay.
talk about something. So from what I understand, you pulled questions from a book.
Yeah, there's literally something called the Book of Questions, and I literally just took questions that I thought would be interesting and then put them on my notes and then thought I'd just ask them on the podcast.
Yeah, I mean, our last podcast was a little scattered, but I mean, whatever. It's a conversation. It's, what'd you call it, art?
Oh, well, it's art.
Yeah, it is. I mean, it's the art of talking.
Yeah.
Yeah.
I like art, but in my mind's a definition of art's human expression, and talking is very human, and it's basically expressing yourself. And I mean,
yeah, I like having the conversation be kind of open ended and go wherever it kind of wants to go. But we can also have topics too.
I like both.
You know?
I like topics and just a normal conversation.
Yeah, exactly. And plus, I think next time we'll have someone we'll have someone like a guest or somebody. Like you know, like I kind of want to just have different people come talk with us.
I completely agree.
Yeah, around Santa Cruz. You know, I kind of want to change the name of this bit to like something that has to do with people of Santa Cruz.
Yeah, it's really cool with the internet because you can be your own journalist. Like you don't have to worry about a filter of like a media company or something. You can just put your truth
and whatever
out there.
you want to say.
Exactly.
Whether even whether it's true or not, you could just say it. You know what I'm saying?
Yeah, exactly.
So let's dive into one of these questions that you.
Really? Okay.
Yeah, or actually, let's talk about a high school football, man. Remember that?
Yeah, I remember that. That was really fun.
That was really fun. How's your knee?
My knee? Well, I tore my ACL my senior year.
For those
People say first play. It was
know.
the second play.
Second play of the game.
Second play. It was on kickoff, and I was just sprinting down. And I was like probably got 40 yards down there.
I remember watching the tape and watching your knee.
Oh yeah,
buckle.
in was it in game film the day after or the Monday after? Coach replayed it literally like 6 times in a row of my knee just going crack.
Yeah, like
crack. And no one hit me.
There's no one around you for like there's like 5-yard radius of nobody.
I just tried to cut in the turf, and I evidently got caught by the turf monster. My knee went, and then
there goes my senior season. Was it like the 10-yard line got you or something like that?
No.
What was it?
I don't know, like 10, 15-yard line got me.
And you were always the first one there because you were like retarded fast.
I was relatively quick.
You were pretty quick.
For a normal, I'm not like obviously not NFL caliber talent, but
you were probably. I would probably put you the fastest one on the team.
Fabiano. When it's not close, really? Obviously Fa, yeah.
Oh, was he faster than you?
Yeah, he was faster than me by like at least 0.2 seconds on the 40s.
Oh, really?
At least.
I don't remember. I mean, I believe it. But...
Yeah, he's the reason. Well, he's the one going to Berkeley. Doesn't he hold the SoCal all-time rushing record?
Does he?
I thought it was
Dwight Lowry.
I don't know. You can Google it. I have no idea.
From what I heard, Dwight like played every position at the same time on the field.
Probably. He's on the Chargers now.
No, I thought he was on the. Oh wait, is it?
I'm pretty sure he's on the Chargers.
Honestly, you probably know more than I do because I don't really pay attention.
I don't really either. So
Yeah.
ever since high school ended, I kind of stopped focusing on sports.
Because I'd rather play.
Exactly.
You know what I'm saying? Like I'd rather be in it. But
I'd rather be doing something than just watching. That's just me. But the only thing I really follow nowadays is mixed martial arts.
Me
so.
too, UFC.
But not as much as I used to because I have other responsibilities.
No, I don't. I can't remember the last time I watched a full football game. Even when I watched the UCLA games live at the Rose Bowl, I couldn't stay for the whole game because it's just too long, bro. Mm-hmm. It's like 3 hours of just sitting, watching the game, and I just get bored. I'm too antsy of a person. I don't know. I need to be socializing, to be talking. I don't know. But those games were fun though.
Yeah.
Have you been to a college game before? A college football game?
Yeah. The last one I went to was over at Berkeley.
Oh, you went to a Cal game?
Yeah. Go see Fall.
I saw Cal and UCLA play. We beat them the first time. And when I was a junior, and in my senior year, I can't remember.
Pretty sure they're obviously playing this year because they're in the same conference, but I don't know if it's down in LA or if it's
I don't think they've been doing that well though in the last few years.
Who?
Cal.
I don't know.
Yeah.
I could check online.
But I think the first official UCLA game was last weekend, I think.
Mm-hmm. Yeah, NFL and college started, right?
Yeah, exactly. So no. Is UCLA better than Berkeley? That's the number one question.
UCLA versus Berkeley football.
Yeah, exactly. Like
that's okay. Just a
wait. Go back really quick. UCLA is slightly larger school. UC Berkeley
is about
slightly more
roughly
difficult
3,000 more.
Okay, look. There's only a 0.4% difference in acceptance rates. That's slightly cheaper state tuition.
UCLA offers slightly cheaper in-state tuition.
Actually, there was a college review board who ruled UCLA the #1 public university in the entire country.
Cool, you just graduated from there. Congratulations.
Right?
Yeah,
like,
that's awesome.
Yeah. So I'm so all right. Now let's talk about football though.
Oh yeah, no. The UCLA versus California takes place on Friday, November 24th at 7:30 on FS1, the Rose Bowl in Pasadena, California.
Is that the day after Thanksgiving or is that the week before Thanksgiving?
Thanksgiving's the 26th.
Well, it's the Thursday. It's like the last Thursday in November.
Thanksgiving 2017.
I think it's the last Thursday in November.
November 21st is the day after
Thanksgiving.
Yeah, the day after Thanksgiving is going to be.
That's cool.
Yeah.
That's cool. I don't even know where to watch games, college games on TV. Mm-hmm. Do they play them on ESPN and stuff?
They usually play them on ESPN. ESPN, they usually play them on Fox and a few other stations, but yeah.
That's cool, for sure. Well, yeah, man. Speaking of high school football, would you have played in college if you could? Like, would that be something? Like,
I wouldn't have.
Like if let's say you got scouted for running back or something.
Unless I was legit. I mean, like.
Well, yeah, of course. I'm not saying like you're not legit, and they're just like, yo, go, just go in there, dog.
No,
you got it.
It's if I just go like this, I'm just gonna get wrecked.
Yeah. Rudy.
Rudy, yeah, I don't want to be Rudy.
No, if you were like,
is it like pulling me off of like a stretcher because I broke my neck?
Let's say you ran like a 4.140 or something crazy.
Okay.
Or 4.240.
Let's just say I'm very athletic.
And you had very quick. Let's say you weren't huge, but you were very fast, and so you got like scouted to play, like a running back or something like that.
Running back, yeah.
Would you play?
Yes.
Yeah.
Yeah, if I was actually legit, yeah. Like this, no.
Okay. What's like this? Bro, you're pretty athletic.
No,
you're the most athletic
I'm not,
person I know.
No, well...
You are.
You
are the most athletic person I know.
I'm like 5'8", I'm like 162 right now, but it's like, there's a difference between a normal person who's athletic and then like college level, NFL level super athlete athletic. And
I would not put the NCAA D1 schools at a super athlete level. There are super athletes
I was gonna say,
who
exactly.
go to the NFL.
But they're, yeah.
Bro, but I've seen, I mean, bro,
Me too, I know what you're
they're not super athletes in any sense of the word. They're strong, they're big, but they're not super athletes.
I agree.
Like, I would say... Yeah.
I wouldn't want to go up against, like, the next Cam Chancellor.
Yeah.
And, like,
I
just get some 6'3", 230 person that runs a 4'4", just ending my life.
Did you go with us to that football camp in San Jose with SoCo High? Do you remember that?
I think so, yeah.
There was a football camp in San Jose. But, bro, that was not fair. Okay, it's the skills positions, it was fine for them. But then there was the linemen. Bro, it was like me, Nick Prentice, and then it was like, I think it was Noah Bistrin and like Thomas...
Okay, this is junior year. I didn't play football junior year. I was having some trouble.
No, it was the summer after junior year.
Yeah.
In between junior and senior year. So you played then.
I played that, yeah.
So it might not have been that team. It might have been...
I remember that.
Oh, you know what? No, I think it was coming into junior year. Mm-hmm. Yeah, it was. So you didn't play. You weren't there. But anyways, there were high schoolers that were like 6'3", 6'4", 250. Easily. And I'm like lining up against them, doing one-on-one. like
Put your head on their hip,
dude.
Put your head on their hip and drive.
I look like,
Get leverage.
Like I'm not small, but they made me look like I was
Tiny. Yeah, I mean, that guy said super athletes.
I'm like, whoa.
That's kind of the crazy thing about football is there aren't weight classes.
Oh yeah.
Like in wrestling, you at least have you're at least wrestling or grappling with someone that's your size. But you can be my size and you literally go up against someone that's like 6'7".
Yeah,
that's completely legal.
Look up Sean Rogers. I think he used to, or he plays for the Browns. I think he weighs like 300.
Sean Rogers.
He has a record. I don't think there's a D, but.
He's like 6'4".
He's like 300 pounds, and he's like shaped like a bowling ball.
350.
350?
According to Wikipedia. He's 38 years old from Houston, Texas.
350. He's not missing meals, bro. He's eating his Wheaties every morning.
He was also known to play running back near the goal line on his high school team. I think it says his high school.
Well, how can you tackle that? That's a literally walk. That's a walking.
You put a pork chop on.
That's a walking pork chop on. Like that's dangling.
See if you can get him to stand still, then you just get everyone pushing.
He's literally like a walking Toyota Scion. Like that's he's like literally.
It's 350. Yeah, it's like a baby calf.
Dude, seriously.
Calf. I don't know. Bull.
Calf. Yeah, I think that's the right.
What did you study at UCLA? I totally forgot.
Good way to change the subject. I studied psychobiology. That's where my major is. Bachelor's of Science in Psychobiology.
Psychobiology?
Which is a hybrid of biology and psychology. And it's a lot of neuroscience, a lot of psychology, a lot of biology. But I think the biggest thing I took away from it was the behavioral part of it, the psychology part of it, which I thought was the most interesting part. Because we study things from development to neuroanatomy to addiction, like psychology of addiction, to brain and health.
What do you remember
behavior.
about the psychology of addiction?
I just took it, so I remember a lot. I mean, remember when we were talking about synthesizing heroin? Well, that's where I got that from. So that was from that class.
Yeah.
But
because the withdrawals from heroin are like really bad, right?
Yeah.
From what I hear, you can't necessarily die from it.
You can't die.
But it's just like you're getting tortured. Yeah. Basically.
Well, what happens is like everything. You know, one of the side effects of heroin withdrawal is spontaneous ejaculation.
No, I didn't know that. But that's interesting to know.
I know. Could you imagine just be like sitting somewhere and then all of a sudden you just go?
Surprised more people are addicted to heroin, Ben. Jeez.
I know. No, that's the withdrawal though. That's not part. It's a downer. And so when you withdraw from it, you become hyperexcitable. All your systems become hyperexcitable. You're warm. You're shivering. Your
body's basically out of control and trying to equalize.
Yeah, it's like a bad flu. And for the most part, you can't die from it. But what you can die from is alcohol withdrawal.
That's what I heard.
Which is gnarly. Which is just as gnarly too.
If you're like a binging alcoholic, because basically your blood's gotten used to having high alcohol content.
Yeah. Well, the thing about alcohol that's different from heroin is heroin acts on the opioid receptors in the brain, which is pretty specific targets in certain areas.
Are there natural opioid things?
So when you work out and you get that runner's high or that workout high, those are endorphins. Those are natural.
Natural opiates?
Yeah, those are natural.
Naturally occurring in the human body.
Yeah, they're endogenous is what you call it. Where heroin and stuff is exogenous, which is outside. Okay. But with alcohol, it works on a lot of different neurotransmitters. It works on opioid transmitters. It works on your adrenaline system. It works on nicotine receptors, even like THC receptors. It potentiates a lot of receptors, meaning that it makes them more likely to be able to release neurotransmitter, or it just potentiates a lot of these different. So it acts on so many parts of the brain. Okay. So when you stop, you have all these systems that are kind of out of whack. And then also the thing with it's hard to target withdrawal with therapy because there's not one drug that's gonna completely replicate. Like oftentimes, if people withdrawing from alcohol are given benzodiazepines or like Xanax or like Valium because those are the most similar, but they don't replicate what alcohol is exactly like. So there's still bad withdrawal symptoms. But yeah, whereas nicotine, you can just like take a gum, like a nicotine patch or like one of those Nicorette gums, and then you can like reduce the craving because it's just nicotine. It only acts on the nicotinic receptors. Yeah, exactly, in the brain. So it's more specific. But alcohol is way more difficult to help with the addiction and things like that.
Is it because alcohol gets into your bloodstream, right?
Alcohol, yeah.
Your bloodstream basically circulates throughout your entire body, so there's going to be leftover residue in parts of your body. This is my pseudoscience. Don't
No, it's true.
Yeah. Oh, okay. So then,
wait, what did you say?
That because alcohol reaches the human bloodstream, blood's gonna be circulating throughout the whole body that the ability to withdraw from that may be harder. I don't know.
No, it's just mostly with your brain.
With your brain,
it's because it potentiates a lot of these receptors, it activates a lot of receptors. It's initially a stimulant when you're drinking, and then it becomes a depressant. So it has so many different effects on your body.
Gotcha.
Yeah, and it's also bad. It's pretty much a toxin. It gets converted from alcohol to, I think, acetaldehyde, and from acetaldehyde it gets converted into I forgot. Alcohol acetaldehyde or something, but it's a toxin.
Do you know what type of doctor you want to be, or do you still want to be a doctor?
Yeah, I do. I kind of actually interested in psychiatry.
Psychiatry? What is psychiatry? I'm not too familiar.
Psychiatry is like psychiatry, like it's brain. It's like you're working with patients who have mental health disorders,
okay,
or who are depressed, or who are suicidal, or even PTSD, or not necessarily, but it's a mental health doctor pretty much.
Okay. Yeah. And what's the difference between a psychiatrist and a psychologist?
Well, psychiatrists usually work closer with pharmaceuticals because they're doctors, so they can actually prescribe medicine. I think there's some clinical psychologists who can prescribe medicine, but for the most part, they're not MDs, they're not medical doctors. Mm-hmm. But a clinical psychologist is more concerned, I think, with behavioral health therapies, cognitive therapies. They're more, I think they're more holistic in the sense that they're more... They have a lot of different type of mindfulness practices, and they're more guidance. I think they're more for guidance. Whereas psychiatrists are more targeted type of medical professionals.
Yeah, they're like a psychologist is more geared towards like talk therapy and trying to rewire someone's brain.
And psychiatrists is similar too. And I mean,
psychiatrists can prescribe medication.
Yeah, like they can put you on Zoloft or all the other antidepressants, which I don't know, Prozac and.
Do you know how people determine whether to send someone to a psychologist or a psychiatrist, or is it just? I'm assuming a psychiatrist has to be like.
A psychologist, a clinical psychologist, I don't think would deal with a patient who has schizophrenia or who has bipolar disorder, or who has borderline personality disorder. I don't think they would deal with those patients because those are pretty severe. Like, you need drugs for those patients, and psychiatrists, I think, deal with those more severe cases in general than psychologists do, because clinical psychology, you can also go into like marriage counseling or family counseling or things of that nature. But I think psychiatrists are more focused on like the diagnosable, DSM qualified like mental health disorders.
Would you ever work as an ER surgeon?
Oh my God, I don't think so. I don't think so. The thing is, I haven't had enough exposure to like surgery in the sense from hospital surgery. I've volunteered and worked in a hospital, but I haven't had enough experience in surgery to actually be able to say I would want to or would not want to do it. Yeah. I wouldn't be opposed to it, but it's like I just don't know.
It seems super stressful, obviously.
Oh well, yeah.
I mean, you're the ER surgeon, so.
Yeah, I did see a motorcyclist come in, who had his whole like leg super messed up, to the ER. But and I saw the doctors working on him, but it's like 15 people on one dude, and then there's like usually one doctor, like 15 nurses, 10 nurses, 5 medical assistants, and like one or 2 doctors, just like because it can be gnarly, like gunshot wounds, GSWs, those are pretty gnarly too. People come in like bleeding out of their neck or something. Like, what do you do? Actually, I don't even know if I'm allowed to say this is HIPAA, but I don't say any names. But there was one guy who was in the intensive care, and he had a gunshot wound on his jaw, but it was self-inflicted. I think he tried to kill himself.
Yeah.
But
that reminds me, I listened to this podcast from this former Navy SEAL guy named Jocko Willink, and he had a former ER trauma surgeon on there, and his name's Peter Attia, and I think he works with helping reduce diabetes now. But he was talking about one of the issues that he had was one of the patients that came into his ER. He was working as an ER surgeon in Maryland, I think. I think Maryland, and one of the guys that came in, he killed his wife, he killed his daughter, and he tried to turn the gun on himself and then kill himself. But the problem is he basically missed. He blew off the side of his face, but he didn't kill himself. And he was talking about how this was the one case where he really didn't want to save the patient. He ended up working on the patient, but he just like, why am I wasting any resources on this person?
Yeah, so that is gnarly.
So that's one of the ethical things I was talking about. Earlier I was talking about there's a few ethical issues because it would be a doctor. Yeah. Like, imagine you were that person, like from like what's it called, Hippocratic Oath, where it's like you definitely save the patient, but it's like in that context, it's like you can understand why he's like, I kind of don't want to save this dude, you know?
Is it Hippocratic?
He did. Yeah, it's like
I know it's.
I'm pretty sure
it's Socratic or because I don't think it's Hippocrates. Is it?
Maybe, I don't know, but there's if I'm not saying there's every doctor takes that
you have to.
You have to save every patient, and if you want to deal with the philosophical side of what they've done, that's up to the legal system. But that's the one time he said he really didn't want to save the patient. I mean, it's understandable. So yeah, that's why like that ER, like I can understand we pay those people a lot of money. It's like having to make those types of snap decisions. It's freaking stressful and difficult. So
no, it is. Like where did I hear about it? Did I hear about it? Was it on a TV show? I think I heard about it. I think this actually happened. There was like an African American doctor, a black doctor, and then I think he was working on this guy, this like white male who had a gunshot wound or something. But like on his chest there was this big swastika and like the SS, and you're like, well, I mean, we have to save him. It doesn't matter.
Yeah.
But I mean, that's pretty. It makes you think like, okay.
I saw this like old photo from like the 1960s, 70s, or 80s, and it was like this basically this KKK member was in the ER, and like all the people that were working to save his life were like African American nurses and doctors. So
yeah, right.
Yeah,
and that's I mean, that's not really ethical. That's just like straight. That's just
it's just
racism.
It's just like how I put this. It's just like a contradiction type of thing. So,
right.
But still, they're doing their job. So.
But the ethical question, what you originally brought with the guy dude that came who killed his
wife and his daughter, and then tried to kill himself, but ended up failing at that.
That's gnarly.
Crazy as that is.
That's crazy. Here's a so I took a medical ethics class. Here's one of the questions that was like brought up, I think on the first or second day. If you were walking along, let's say you're walking along a forest in this, I'm just repeating this verbatim. I don't know why it's a forest, but that's what she was.
What's the story? Let's go.
You're walking along in the forest by yourself, and you stumble across like this big group of people, and there's 100 people. Well, for the sake of the story, I think it was like 50. There's like 50 people lined up, and there's just one dude with a gun who's gonna kill them all. He says, if you take the gun from me and kill one person, I'll let the other 49 go. If you don't kill this person, then I'm gonna kill all 50 of them. What do you do?
Me?
Yeah.
I disarm the guy, beat him to death.
No, man, that's not the...
Yeah, you're giving two choices, no.
No, you only have those two choices. Like, it's ethical. Obviously, yeah, you want to try to get the gun, but you don't have that option.
What principle are we basing it on?
Exactly, that's the argument. What principle are you basing on? Your own principles.
I guess I'd save... If you have to save more people, you save more people.
And you'd kill the one person.
I wouldn't enjoy doing it.
No, that's not... I know you wouldn't enjoy it. If you did, that's a different question.
Wait. Given the two dumb answers you're making me choose, I'd save the 49.
Okay, good.
But the first thing I said is probably what I'd do.
Well, obviously you want to disarm the guy. But
if I knew it 100%, I could.
Okay, yeah, but you never know anything 100%. But yeah, those are the ethical questions. You have to build constraints and work around them.
Here's another one. This one's a little more... Okay, so I was watching the same podcast with the MD Dr. Peter Attia, and he was talking about he needed to dose this patient this drug called gentamicin. I don't know. It's an antibacterial drug that's very potent. From my understanding of it, its bacterial growth rate's really high, so you have to dose it correctly, because if you dose too much, you can cause liver and kidney failure and basically kill the patient. So you have to wait. What happens is there's this law that's like you have to only dose after 7 a.m., but he thought he could figure it out, a more efficient way of dosing people. So he came up with basically like a mathematical model to calculate the optimal time to give it to the patient. So then he tested it on the patient with high confidence, and it turned out to be correct. But he ended up getting in trouble I think as a graduate student, because it violated the law, even though the law was basically incorrect. Right. So if you're in that situation and you know you have a solution to a problem that's more beneficial to the patient, but there's a law that you'll get punished for violating it, what would you do?
I'm not a big fan of laws. They're more like guidelines. No, I'm just joking.
No,
I wouldn't.
No. This is not a good question.
I wouldn't break the law.
You wouldn't. So you dose them at 7?
I mean, given the constraints.
Yeah.
I mean, optimally, you'd want to be able to change the law, right?
Exactly.
Eventually, and I'd probably go to any of my superiors, because I'm a graduate student, right? So I have all these PIs working.
Exactly. You're basically the lower. Yeah.
Right. So I'd probably go up to them and then there's obviously steps that you can take in order to change the law. or fix what is broken. But at that moment, like if I knew that this was gonna work, and not kill people,
you had very high confidence it was gonna work.
I wouldn't break the law though. I don't think that would do me any good.
I'm not a medical student. I don't plan on being a doctor, but I would break the law because I know that my model is more beneficial to the patient than the law, because the law can be changed, but the health of the patient in that time does not.
Yeah.
So I would do that, but there should be an understanding of the people that hold the power that science, our understanding of science, can outpace our legal system, and that person shouldn't be punished for doing the right thing, even if the law at that time said it was wrong, because the laws need to change to fit what benefits the public the most.
But if everyone's breaking the law, then you're...
I'm not saying everyone breaks the law. I'm saying in that context of helping out that patient, getting dosed correctly, that antibacterial drug that could potentially save their life.
Yeah.
Then yeah.
Yeah, ultimately you'd want to follow protocol.
And I would lay out that argument of why I did it to the board to make sure that yes, I did break the law, but this was best for the patient. You should change the law is what I would do. But
yeah.
I'm not a medical doctor.
No, yeah. And you would probably still get in trouble, and you might
exactly.
You might
and Peter Thiel did get in trouble, and he was going to get expelled, even though his model was presumably correct.
Okay. So. Yeah, that is tricky because science will always be ahead of law because
laws move slow, and our understanding of knowledge, especially nowadays with the internet.
Well, laws come from it too, so you can't. It's like the laws come from the things that are being discovered, and so it's always going to have to follow.
Yeah. That's the thing is. That's the thing about laws is, how I put this, laws are very absolute, but the world's very fluid about what to do. So that ethical question of knowing when to basically bend the rules or sometimes break them, I think is an important one for someone to have.
Yeah,
because laws, at one point you could own human beings. I mean, in some places in the world you still can, but that doesn't mean it's right. So it really comes down to your moral compass of what you think is right in that moment. So in my mind, I would help out the patient even if it did violate some dumb law.
And that's pretty, that's pretty selfless. Meaning that you probably knew you're getting in trouble, but
it was
taking that
because you're still following that principle of doing what's best for the patient.
Yeah.
With what knowledge and tools you have to work with.
And that is a really tricky situation.
Yeah. So that's what I was trying to bring up.
No, that's a good ethical question too.
Yeah.
But
that's so important is to have not just the medical training, but that ethical training as well, because those situations come up and it's like, I don't want to save this dude that just killed his wife.
And that's what my professor does. Is she does ethical training on clinicians.
That's very important.
Because clinicians obviously sometimes don't necessarily have an ethical, they'll most likely just be a practicing physician, not really having taken an ethics class, and they're not that they're unethical, it's just that sometimes they just don't know how to think about certain situations, because there will be things that I have brought up that they won't be prepared for.
Yeah, that's kind of science. I mean, it's like a systemized body of knowledge based on evidence and experimentation. And the key is that experimentation, because in order to make that leap in knowledge, you need to take those risks that haven't been discovered before.
Yeah, exactly.
And so that's
the primary function.
Yeah, so knowing how to navigate that line is very important. So
yeah. Well, ethics is important, especially in every single field.
Yeah. That's how we run presumably a functioning society, is to have people behaving as ethically as possible. So.
Yeah, with a moral compass.
Unless you're a sociopath, you just go around hanging cats and doing bad things.
Yeah, that's why I want to be a psychiatrist.
To stop those people. Yeah.
Yeah, exactly.